Okay, hi, I'm Serena Gurfey along with Dominique Archo. We're students at ECPI, and we're doing a presentation about magnet hospitals. Magnet organizations are recognized for superior nursing processes and quality patient care, the highest levels of safety, quality, and patient satisfaction. Magnet recognition programs, they recognize hospitals that foster positive work environments, retain nurses that provide exceptional patient care. Magnet status is something that various hospitals aim towards as an organization as well as a collective individual. Continued progression towards healthcare excellence and innovations. There's submission requirements to become a magnet hospital. The hospital needs to apply online. There is a fee, and they need to send in supporting documents. The chief nursing officer, they send in organizational charts, their nationally benchmarked nurse satisfaction survey tools, nurse manager and nurse leader educational eligibility criteria. 100% of these nurse managers and nurse leaders must have a degree in nursing, either at the bachelor level or at the master level, and the CNO is ultimately responsible for sustaining the standards of nursing practice in all areas in which nursing practice.
Thank you, Serena. So now we're going to discuss the magnet model. The magnet model involves information related to transformational leadership and structural empowerment. Transformational leadership involves nursing services management, philosophy, and practices. The ANCC has a model that's a representative of the characteristics of a magnet facility and clearly demonstrates the 5 areas that any organization aspiring to magnet status must address: structural empowerment, shared decision-making, healthy working environment, and how the nurses and the colleagues are able to work together for the better improvement for patient outcomes. When you think about the magnet model, you want to look at the exemplary professional practice, the new knowledge, innovations, and improvements, as well as empirical outcomes. For the exemplary professional practice, you want to look at adherence to standards for improving the quality of patient care. When you're looking at knowledge and innovations, you want to look at research, mentoring, and educational programs. And for empirical outcomes, you want to look at what's been measured for the effectiveness of the clinical practice. Leadership of the chief nurse, executive, and competency of the nursing staff. You also want to pay attention to the cultural and ethnic diversity of patients, their significant others, and the care providers in the healthcare system. This also brings into mind that you want to have, as a nurse, you want to have awareness of transcultural care, and that's inclusion of all people and of their different cultural backgrounds that will ultimately affect their nursing care. The magnet status criteria has been shown that facilities with magnet status have been seen an incline in improved patient outcomes. Magnet organizations must consistently keep up with guidelines, evidence-based practice, and research-approved initiative. The necessary requirements must be met by the organization as a whole, which ultimately has to start at an individual level. In order to show the core nursing staff the importance of continued education and research, the nursing administrators must lead by example by holding, at the very least, bachelor's and master's degrees to be in positions of leadership.
Okay, one of the hospitals that we found that has a magnet status is Bon Secours St. Francis Hospital, which is located in Charleston, South Carolina. It is the first hospital in the Low Country. It was awarded in 2010, and it is one of 2 hospitals in South Carolina that has the magnet status. This hospital is a faith-based hospital, and it is actually ranked 4th in the whole state. It has 204 beds, a 24-hour emergency room, a women and children's services, and a cancer center. This hospital has 75% of the nurses that are hired will have a BSN as part of the transformational leadership portion of the magnet. They don't actually require all of the nurses to have this. They have 75% that will. And for the academic practice partnership, they have students, nursing students that come from South Carolina, or I'm sorry, the University of South Carolina, the Medical University of South Carolina, Trident Technical College, and the school I went to, Charleston Southern University. They have shared governance and decision-making for structural empowerment. They have unit-based councils that discuss professional practices, research, quality, and patient that are hired that do not currently have their BSN have 5 years to complete their BSN. For new knowledge and innovations and improvement, they have a new stroke center, a neurospine center, and a bariatric center. These units are dedicated to the specially designed to help these patients recover. And for their outcomes, they have decreased risk of falls, pressure ulcers, and other complications.
So now I'm going to talk about Sentara Norfolk General Hospital, which is also a magnet facility. So this is the region's first magnet facility, and the region consisting of the Tidewater area as well as the Williamsburg area. Sentara is, as a whole, is committed to providing high quality healthcare through innovation and the use of the latest technology, and has always been a firm believer in empowering healthcare for the consumer so that they can make informed decisions and take an active role in their own care. One of their sayings or their mottos is always have a questioning attitude, and we'll get into that point a little bit later. It's important to know that Norfolk General alone has 525-bed tertiary care facility. It's a level 1 trauma center and burn trauma unit, as well as nationally ranked heart program within the region. The heart program is the region's first and only dedicated hospital, and it's unlike any in the area within hundreds of miles. It unites a long-standing team of cardiac super specialists within an advanced setting built from the ground up for superior cardiac care. When we talk about Sentara Norfolk General Hospital in relation to how it's had an academic partnership, you'll often see a lot of students as well as nursing recruits from Norfolk State and Old Dominion University. I am a product of Norfolk State for my associate degree, and I definitely did several clinical rotations there, as well as subsequent classes have come up there. You'll also notice that for Norfolk General, they are Hampton Roads Consumer Choice Award winner for the past 12 years by the National Research Group. For structural empowerment, you'll notice that they have a forensic nurse examiners program, and this is based out of the emergency department at the Sentara Norfolk General. The program is consisting of registered nurses specializing in providing immediate, comprehensive medical forensic examinations, as well as evidence collection on sexual assault and domestic violence victims. The group works in conjunction with the local law enforcement, Commonwealth attorneys, and the response crisis services. Earlier, I mentioned to you that one of their common themes is always have a questioning attitude. That goes along with, for the patients, they should always be able to ask any important questions related to their healthcare, as well as the nurses should always have a questioning attitude related to the patient's clinical progression and when they're interacting with different members of the multidisciplinary team. Lastly, for exemplary professional practice, there are several different community resources identified, and they use this to identify priority health problems within the area. And I do know that Norfolk General has a clinic that it definitely offers, as well as there's an attached children's hospital that children of the area specifically go to that hospital versus going to the main hospital because they have specialized nursing cares to work with that population. So when you're now talking about the new knowledge and innovations related to Norfolk General, you want to look at that Norfolk General does a health risk assessment. And when they're doing their health risk assessment, they're trying to look at what are some main problems that they see in their specific community. Because again, the hospital is meant to serve the community in which it stands in. And a lot of their outcomes were used to effectively address the problems such as obesity, nutrition and fitness issues, behavioral health, depression and substance abuse, heart disease, cancer. These were the four most common conditions or the most seen conditions within the area. And they also helped by assessing these conditions and looking for ways to improve or decrease the likelihood within their community. They're following into their mission, which is to improve health every day. The community health needs assessments also used as a foundation to address the priority needs as stated before. And that will
Great. And these are
go ahead.
Sorry, that will conclude our presentation. Thank you for watching.
Thank you. Bye-bye.